In this video, we are going to be looking at the word hydrocele. Notice that the word hydrocele is a combination of two words, which is hydro and cele. The word hydro simply means water. The cele means swelling or hernia. So when we put the two words together, which is hydro and cele, we get that term literally means water swelling. In medical terms, a hydrocele is a type of swelling that occurs when fluid collection in a thin sheet surrounds the testicles, causing the scrotum or groin area to swell up. Here we have a structure of the testicle without the hydrocele, that is without any accumulation of water or fluid. And here, if you notice at this point, we have accumulation of fluid. This is fluid. So, and that is why we refer it as hydrocele, because there is accumulation of fluid. And this, there is no accumulation of fluid or collection of fluid, we call it normal testicles. When we have accumulation of fluid, that is water inside the testicles, we call it hydrocele. Notice that the hydrocele does not pose any threat to the testicles. They are painless and they will disappear definitely without any treatment. But still, it is also advisable to see a doctor in critical cases such as testicular cancer. Now let's look at the causes, symptoms, types, diagnosis of the hydrocele. Now let's start with the causes. Notice that hydrocele can occur at any age, but is more common at newborn babies. Hydrocele can occur naturally or due to an underlying injuries or diseases. Other causes are congenital, injury or trauma, infection or inflammation, blockage of spermatid, cause pain fluid imbalance. The symptoms are as follows. Number 1, we have the swelling in the scrotum, pain or discomfort, heavy or itchy feelings in the testicles, redness or warmth in the scrotum. Now looking at the types of the hydrocele. There are two types, which is communicating and non-communicating hydrocele. Although hydrocele is harmless in most patients, but it can present differently, and this depends on how it develops in the body. The communicating hydrocele, this is a type of hydrocele that is connected to the abdomen, and the fluid can flow in and out. It's like a tube that connects the scrotum to the abdomen. This happens when the sac around the testicle does not close all the way, allowing fluid to flow in and out. So what I'm trying to explain here is this. Assuming here we have an abdomen. So below the abdomen, here we have our tight, and in between we have the testicles. So we said if the sac around this testicle does not close, it's more like a tube which is connected from the testicles to the abdomen. It simply allows fluid to pass from the abdomen down into the testicles, in and out, which causes fluid collection inside the testicles and which we call the hydroceles. So the next one is non-communicating. The non-communicating hydrocele, this is a type of hydrocele that is not connected to the abdomen, and the fluid is trapped inside like a balloon that is filled with fluid and cannot drain out. Now let's look at the symptoms of hydrocele. Notice that they are usually painless. The most common one is swelling, scrotum depending on the severity of the swelling. Discomfort or pain may occur. In adults, notice that the scrotum may feel heavy in some cases. It may worsen in the morning, and you can feel better in the evening. Looking at the diagnosis, we have the physical examination, ultrasound or imaginary test, blood test. Notice that your doctor will perform, in case of physical examination, your doctor will perform a physical exam to diagnose a hydrocele. If you have a hydrocele, you will not have any pain, but your scrotum will be swollen, and your doctor won't be able to feel your testicles well through the fluid-filled sac. So in the case of ultrasound or imaginary test, sometimes we include blood test or urine test, which can be used to determine the cost. So in adult, notice that it can go on its own. But if it is caused by inflammation, like infection or trauma, In some cases, notice that if the hydrocele is small, they are usually monitored to see if they will resolve on its own. But if they doesn't, then further medical verification can be performed. So this is it for this video. But in simple terms, you can say the hydrocele is simply like a swell in the scrotum. And when we say the scrotum is a bag that holds the testicles. So it's like a balloon filling with fluid. Sometimes it can hurt or feel heavy, depending on the size. It can happen to human for different reasons. Sometimes being born with it, sometimes getting hot in the groin area, that is where the testicle is, and sometimes as a result of infection. So to fix it, we said you may need to see a doctor. So if we want to see a doctor, what they are going to do is to watch and wait to see if it goes on its own. But remember, depending on the size, as we mentioned earlier, sometimes they can choose to drain the fluid with a needle, and sometimes they can suggest a surgery. So this is it for this problem. I hope you find it helpful. In case you are interested in videos that has to do with liquid accumulation, I also have videos on ascites, which I'm going to drop the link down below in the description. So if you really like this video, please do me a favor by clicking on the subscribe button, also like and share. Thank you for watching, and see you next time. In this